I'm Anthony. I'm Programme Manager for the Humber and North Yorkshire Green Social Prescribing Test and Learn programme here at Hey Smile Foundation. And yeah, just like to welcome you all in joining us. We've got a really good mix of registrations from across different sectors and from across Humber and North Yorkshire and beyond as well. So that's absolutely fantastic. And in terms of today, we're going to be presenting on some of the findings from our region's role as a test and learn programme for green social prescribing. We've got a range of excellent speakers who have been involved in the programme. And we'll begin with an introduction by our Green Social Prescribing Steering Group Chair, Brent, before myself and Hannah talk through the programme delivery and some of the key learning. And we'll then hear from Pete and Trish at the University of York, from Heidi at York CVS, Rob and Claire from Raincliffe Wood Community Enterprise, Emma from Myers Beck Plant Nursery, before we wrap things up with some final thoughts from Gary Sainty, who's head of VCSE at the Humber and North Yorkshire Health and Care Partnership, and we'll be able to open the floor for questions. So I'm going to hand over to Brent now to introduce the webinar.
Thanks very much, Anthony, and welcome to everybody this morning. My name's Brent Kilmurray. I'm the Chief Executive at Tees Esquire Valleys NHS Foundation Trust. We provide mental health services to people in North Yorkshire, York and Selby, as well as in the County Durham and Tees Valley. I was invited to take on the chair of the steering group, probably getting on for nearly 2 years ago, over 2 years ago. And that's been my absolute pleasure to get to know a range of people that are involved in different aspects of the natural environment, managing the natural environment, volunteering and social prescribing, as well as in the mental health field. I want to thank members of the steering group, and we'll talk a little bit more about who's been involved in a moment. But as you can see, a vast array of organisations that have been part of this journey, and as you can see there, Hey Smile have played a key coordinating role here, and a big thank you to them for employing the staff and helping to organise the support function for the overall programme. And a particular thank you to Anthony and his colleague Hannah. And I know there are others that have been involved, Victoria and others that have been involved along the journey as well. And also a special thank you to Gary Sainty at the ICB, who's played a key role. I'll talk about some of the other local and national supporters in a moment. So I think if we just think about, I suppose, what this is about, it's been about partnership working. It's been about bringing together a range of different players, and I'll come to the purpose of this in a moment. But some of you have played a really significant role as people who have delivered services directly to people on the ground, as well as those in the background that have helped to organise and pull this together. What we've been trying to do is to make sure that we have been really clearly focused. So at each of our steering group meetings, we've made sure that we've had a case study brought to us. And we've had the pleasure of visiting some of the sites where some of this activity has been delivered, so that we can experience for ourselves there. And what's clear is, and we'll hear from York University, from Pete Coventry and Trish later on, that actually we've been able to be a part of making a difference to people, connecting people to green blue spaces and providing some life-changing opportunities. Next slide, please. So I've mentioned that Hey Smile have been the host organisation, but this has been a programme that's been focused across the Humber North Yorkshire Health and Care Partnership, and the Integrated Care Board have played a key role in this. The steering group that I've had the privilege of chairing has overseen things, and we've had representation on there from social prescribers, people involved in managing nature and projects associated with that, physical activity, mental health provision, voluntary and community sector and enterprise, social enterprise development organisations, public health and other, I'm sure, people have forgotten to mention as part of that. And we've pulled together to oversee the work that we've been doing. We've obviously been working in the Humber North Yorkshire patch. We've had representation from each of the 6 places that make up that patch as part of that. So this is a test and learn project, and the mission really was to form one of 7 test and learn sites, which is part of a national programme around green social prescribing. We've been really grateful for the support of Sam at NHS England and colleagues from Natural England, DEFRA, Sport England, and the National Academy of Social Prescribing. And really, I think, it's been a true team effort as we've worked through. As I say, the Humber North Yorkshire project has been part of the national programme and one of 7 test and learn sites. And the focus of that has been very much on preventing and tackling mental ill health through green social prescribing. And what its aim was to think about how we can explore how we can embed this idea into mainstream services. And we've been doing a piece of work alongside this, Gary Sainty and I, with support from others from this broader group that I've described, looking at the whole concept of social prescribing within alongside the delivery of what you might call mainstream health services across the whole ICS. And this has been a big part of what we've been doing here as well. Clearly, what we're trying to achieve through this work is to think about how we can improve mental health outcomes, how we can reduce health inequalities, reduce demand for health and care services, and thinking about how we can shape new thinking in this area. So next slide, please. So it's a big area that we've been covering, and it's one what we call in the NHS parlance, integrated care system, supported by an integrated care board, with 6 places: North Yorkshire, York, East Riding, Hull, North Links and North East Links, making up, if you like, the geographic footprint. And obviously there are a lot of different players that work in this space, and you will be representing many of those around this virtual room this morning. 42 primary care networks and literally thousands of voluntary and community sector organisations that we've tried to tap into as many of those as we possibly can, to think about how we can, I suppose, really think about how we can make this infrastructure work for people with mental ill health and mental health needs who want to connect with green and blue space. Next slide, please. So, one of the key things that I think really has been driving us is really about, this idea that well-being of communities should be at the fore, that demand for mental health services clearly has been a significant issue for, again, what I'll call mainstream services, whether that be through primary care or through counselling services, through secondary care mental health provision. It's starting to really start to peak after COVID, and we're seeing the significant pressure on some of those services. The emphasis around mental health care very much these days is not just on the treatment of symptoms, but obviously that's an important part of what we do, but it's also thinking more broadly around this idea of recovery and people supporting people to live their lives, and to think about how they can access new ways to follow an independent recovery pathway, and think about developing tools, social interaction, connections, and support around them that allows them to live good lives, that allows people to live good lives. Obviously, we've been working with the University of York, and we'll be hearing from them later. And obviously what we've been trying to do through this is to learn about what works for people, very much people at the heart of what we're doing, thinking about how through organising, if you like, opportunities, connecting social prescribing in primary care and elsewhere within our system to opportunities for people to get out in the green and blue space. How is that having an impact on their well-being? How is that having an impact in terms of, I guess, some of the other aspects of their life that contributes to that? So, we've obviously been thinking about how this work helps the system, how it could potentially help specific services, and also particular teams and groups of individuals that are supporting people, and as part of the process, developing that learning as we go through. Next slide, please. So I'm really hoping that today's session, you get a really strong feel for how this has all come together as a piece of work, as a programme. Obviously, there is a longevity to some of this work. You know, we've got some further opportunities to keep developing the work that we've been doing. I'm hoping that we can celebrate today what has happened, what's been going on, what we've achieved as part of this. And you are going to hear today from a range of people from across the network of people that have been involved around their experience of this. Obviously, you know, at the end of a piece of work like this, we publish a report, and Anthony and colleagues will be launching that, and we'd be really grateful if you could take the opportunity to have a look at it and give us your reflections on what we've done there. But I just hope you enjoy, you know, participating in today's event, and I look forward to hearing and seeing from you all again soon. And again, just to reiterate how I started by giving a big thank you to you all for your interest in today's event, but also for your ongoing support through everything that we've done and everything that we've achieved so far through this really interesting, from my perspective, a new area for me, but I think really purposeful and impactful piece of work. So Anthony, back to you.
Yeah, a link to this final report will be added to the chat during the webinar, alongside a link to the evaluation report from the University of York. But we'll now go through the sort of key work streams in delivering the Test and Learn programme. So as I said, I'm Anthony, I'm Programme Manager for Green Social Prescribing and work here at Hey Smile Foundation. And as Brent said, we've been the lead provider for this programme on behalf of the Humber and North Yorkshire Health and Care Partnership. So I'm joined by my colleague Hannah as well. So if you'd like to introduce yourself, Hannah.
Yeah, thanks, Anthony. I'm Hannah, so I'm a clinical research psychologist working in Humber Teaching Foundation Trust, and I was seconded to this role working as clinical lead for the Green Social Prescribing programme.
Excellent, thank you, Hannah. So to kind of set the context, we just wanted to kind of say, what is green social prescribing and what do we mean by green social prescribing? Basically, it's connecting people to the outdoors and nature for the many health and well-being benefits that it can have. And there's loads of different activities that make up green social prescribing. So this is a really good infographic from the Nature on Prescription Handbook, which is a fantastic resource for both healthcare professionals and those providers of outdoor activity. And we'll put this in the link. We'll put a link to this in the chat later. But as you can see, there's things like conservation, and there's wilderness focused activities, horticulture and gardening, care farming, but also exercise and physical activity, sport focused, alongside therapeutic activities and nature appreciation. But in terms of the work that we've been doing, a large part of that has been to understand the landscape. And as that map showed of the integrated care system across Humber and North Yorkshire, this is a huge undertaking on such a big footprint. And social prescribing services have been key and are key to green social prescribing. So we've done a lot of work to learn from them as to how they work, any existing good practice of green social prescribing, and also barriers and enablers to referring to outdoor activities. So through consultation, you know, we understood that the main barriers were a lack of knowledge on local opportunities, staff capacity to research, connect and validate offers and activities, transport and access to activities for potential referrers, and also the impact that COVID-19 and the cost of living crisis has had on those accessing services. There were many enablers, including areas having strong local groups and organisations delivering outdoor and in-nature activities. Green social prescribing having a very positive focus for potential referrals, but also staff who had personal experience of being in the outdoors and nature and being able to convey the benefits to those that they could potentially refer into activity. So as a result of this consultation, we've been able to share information on groups and activities to different services. And we've also delivered training on green social prescribing as well to various social prescribing services across the region. And this has been in partnership with Yorkshire Wildlife Trust and Natural England. This has covered what green social prescribing is, the health benefits of outdoor and in-nature activity, nature connectedness, and also kind of local opportunities. And we've also been able to work with Natural England and North York Moors National Park to give healthcare staff immersive days out in nature so they can experience the benefits on their own well-being, but also learn about potential opportunities and referrals. The team have also sought to understand what groups and organisations are out there delivering activity, and why we know this graphic isn't a complete picture, it gives us a really good insight into the opportunities that are available across the region. So while there's no one system for putting information on outdoor and in nature activities, we have identified over 621 activities across the region. This has shown us that physical activity is a key player, largely through local walking groups, but gardening activities and conservation activities make a big part of the picture as well. That also means that there's other activities going on as well, so nature connection, care farming and bushcraft activities as well. Alongside that sort of desktop research, we have engaged with over 150 groups and organisations to understand their experiences. And we've talked to them about their connection to referral pathways. For some, this has been strong, but for others, the links weren't there. We also have talked about monitoring and evaluation, with many having evaluation and monitoring set by their funder. Very few were using outcome measures to measure the impact of health and well-being, and these were found to be unsuitable for particularly outdoor and in nature activity settings. And lots of the groups said that they did have capacity for more engagement, including through healthcare pathways, but COVID-19 had impacted on their volunteer capacity. Funding, of course, was a big challenge for groups, so small short-term pots of money, and lots of challenges around funding in terms of the time it takes to write bids, the competition for different funds, and not always being easy to fund the continuation of activities. And other support needs highlighted by groups included promoting activities, formalising referral pathway links, and that support in monitoring and evaluation. So we have been able to fund 36 different projects across the region, which are all shown by this map, and we'll hear from a couple later. So in 2022, we did release just over £350,000 to the voluntary sector. This was through the programme direct, but also through additional funding secured through NHS Charities Together by the Health Tree Foundation. And as you can see, there's a range of different activities funded. And while lots of the projects are still running, we do know that so far they've engaged with nearly 1,400 people, 85% of people taking part are working age, and 2/3 of those participants are female. These are just some of the projects. So Open Countries Allotment in Harrogate, Closer Communities Dads Behaving Madly group, which supports male carers, St Nick's Ecotherapy Programme and the Bushcraft Workshop within that, and the Vale of York Athletic Communities Move More Outdoors, so taking exercise into green space. And we've had lots of great qualitative feedback about the impact on health and well-being that these projects have had, and our final report has some amazing case studies within those. There's been lots of successes through our funded projects, so organisations have worked hard to make their activities accessible. You know, funding has been able to invest in infrastructure to help protect from the elements. New and existing activity has been funded, and 11 of our projects between them have reported 56 new volunteers to help support their delivery. And alongside those benefits to mental health and well-being, participants have also reported increased connection to nature, social interaction and inclusion, building confidence, and improvements in physical health as well. But of course, there have been challenges. So we met with 10 of the funded projects altogether, and some of those challenges are highlighted in this infographic, which captures our day's workshop. And those are the time it takes to promote activities, challenges in connecting and promoting with referral pathways, transport and access, and also ensuring that any monitoring and evaluation is proportionate to the activity and setting. So I'm going to hand over to Hannah now to talk about the third piece of work that we've been doing.
That's great. Thank you, Anthony. So I'm going to introduce the cohort piece of work that we did as part of this test and learn site, and then pass over to my colleagues at the University of York to kind of provide a little bit more detail. So essentially, at the start of the programme, we felt that it'd be really important to gather some data on kind of how people experience green activities and whether it has an impact on their mental health, particularly looking at anxiety and mood. And this was one of the things that was written into the grant application that was successfully funded. So if you can just see the map there, these are all the various social prescribing services that we worked with alongside some mental health teams and some voluntary services. So quite early on in our scoping work, we realised that there were lots and lots of different services offering social prescribing. So in order for us to be able to kind of set a criteria to be able to carry out this data collection, we decided to focus on individuals that were 18 or over, so not looking at children and young people for this particular piece of work, that had access to service such as social prescribing. We did have also some mental health services such as occupational therapy. And we decided to particularly look at people that were experiencing mild to moderate mental ill health. So we connected with all the services that you can see here on the map and did some initial scoping work about what measures we could use to gather this data and how we could set a process in place that would suit them and would kind of suit our needs. And then very early on, we decided that actually we'd really benefit from having a partner, an academic partner, to have a look at this work for us, to be able to safely gather the data, analyse it. And that's who I'm going to pass over to Pete and Trish shortly. So next slide, Anthony. So yeah, Trish and Pete are going to cover kind of more the in-depth findings of that piece of work that we did, but just to think about some of the kind of enablers and challenges that we came across when doing this cohort piece of work. Some of the enablers that we found were really helpful in terms of social prescribers, link workers referring to a GSP activity. It was felt that kind of locations like local communities having a good number of established groups, which kind of resulted in almost a menu of options. So there was 5 or 6 groups that, you know, were really established and ready to accept referrals. That became really helpful for link workers in the what matters to you conversation because they had a clear pathway of referral. Also having allocated time for link workers to connect with groups, experience the activities on offer, and also provide that kind of buddying support. We found that was really helpful because coming out of COVID particularly, some people were feeling quite anxious about joining new activities and really just benefited from that increased time with the link worker to support them to attend a group. One service highlighted to us that GSP was seen as focused on interests and strengths rather than issues and conditions. So it wasn't particularly about, you know, talking about anxiety, but it might have been talking about, you know, somebody used to go out a lot more. Maybe they used to do a lot of gardening and they'd like to get back into that. So it had a really kind of positive focus. And we also found that supportive colleagues kind of referring into the cohort work who had a good understanding of what GSP is and how it could support a particular individual was a really good enabler. So we built up a really nice network of link workers that were really passionate about green, about the outdoors, and we got a lot of referrals that way into this piece of work. And then just a really nice quote at the bottom there. So it was really heartwarming to see people getting interested in projects, encouraging people to do something green. Next slide. So again, I think P and Trish might touch on this a little bit, but essentially we kind of set up this piece of work as an evaluation, and it had a lot of processes in place. There were forms to complete. And what we found really as an overall point is that the complexity of cases coming into some social prescribing services due to things like the impact of the cost of the living crisis, financial housing, employment needs, meant that sometimes thinking about referring onto a green activity was not always able to be part of the conversation essentially because there were other priorities, and then adding in the extra layer of this being a kind of evaluation study. There was a consent form, there was other pieces of paperwork that made this a little bit difficult at times. Sometimes there were limited referral sources, so there weren't so many groups established in the area, or there weren't the right groups for the local population, and that could have been a bit of a difficulty. Sometimes by the time the individual was ready to access green social prescribing, their contact with the service may have come to an end. So, for example, maybe issues around housing might have been managed, and it was time for that person to be discharged, or they'd left the service. A visible reduction in confidence post-COVID was identified, so that refers back to that point about buddying and people needing a bit more time, particularly people experiencing high levels of anxiety. So again, that was a bit of a barrier in terms of recruiting people to take part in this data collection. And some potential referral sites, so some of the groups in the communities felt they kind of they lacked the experience and knowledge. And also, likewise, that the participants, the referrals, didn't feel that activities such as gardening was for them. Maybe they didn't have the suitable clothing. So there was some needs there that we kind of couldn't provide for in this piece of work. So just before I pass on to Trish and Pete at the University of York, if you just move to the next slide, Anthony, just to finish on some really nice qualitative feedback we had though as part of this cohort work. So just some lovely quotes here that people gave to us after taking part in some of the activities. More therapeutic, doing things outside. My depression is now on a more even keel. Some really, really positive findings. Thanks, Anthony.
Excellent. So yeah, we'd like to introduce Trish Darcy and Dr. Pete Coventry now from the University of York.
So hello everybody, my name is Trish Darcy. I'm a research associate with the Department of Mental Health Sciences at the University of York, and I'm one of the evaluation team on the cohort evaluation with Dr. Peter Coventry and Professor Fahrenheit. So this morning I'm just going to introduce the findings from the cohort evaluation. I'm going to start off with a summary of the descriptive and the statistical findings, and then I'm going to hand over to my colleague, Dr. Peter Coventry, who's going to talk about the findings in a little bit more detail, alongside some of the challenges and future areas of research for GSP. So just to start out with then, just to give an overview of the flow of participants through the cohort evaluation. So we had in total 230 participants who were eligible to participate in the cohort evaluation. And of those, 224 were valid surveys. Of those 224, then 173 participants completed a follow-up after survey. And in total, with regards to the final outcomes, we were going to speak about the outcomes for the ONS4 and the HADS in terms of our statistical findings. We had 171 participants who completed both a valid before and after survey. Next slide, please, Anthony. So in terms of then just a summary of our demographics then of the participants in the cohort evaluation, we had the majority of our participants, 59% were female. The majority, 68% were between 18 and 54 years of age. And within that age group, we also had 87% of participants who were within working age groups, so 54 years of age. The majority, 92%, identified as British. Just under half our sample were unable to work due to ill health or disability or were unemployed. The majority of our sample were living in the most deprived areas in England, so that was calculated by aggregating data from the indices of deprivation for deciles 1 to 4. And then while our sample indicated a degree of multimorbidity where they had one or more health condition, the majority of our sample, so 3/4 of the sample, identified as having at least a mental health condition. And of those participants, the majority, 80%, were limited in some capacity with regards to activities of daily living. Next slide, please, Anthony. So looking at referral pathways into GSP here, and you can see a variety.
Sorry, I've just muted you, Trish. Can you unmute? It appears that people are accessing the webinar now, but I don't see them on my list, but there's a lot of feedback. So can everybody please mute unless you're speaking? Brilliant. Sorry, Trish. No
problem. So just in terms of referral pathways, the three main referral pathways then, just under 1/3 of our sample came through self-referral, under 1/4 through mental health services, and then finally 16% through Hull and East Yorkshire Mind, which was a unique referral pathway set up for the cohort evaluation, and that was attached to Forum Social Prescribing Service. Next slide, please, Anthony. So looking at GSP activities here, and here we have recategorised them according to the Nature and Prescription Handbook, which was that slide that Anthony previously showed. And our top 3 GSP activities for the cohort evaluation. So looking at the far right column, just under half of our participants were engaged in horticulture and gardening activities. And that included gardening workshops, such as one-day workshops, to taking part in activities on allotments, to a more structured engagement with a commercial garden centre on a weekly basis for up to a period of 12-16 weeks. Just under a quarter of our sample then were engaged in exercise-focused activities. So these were activities in cycling and walking in green and blue spaces. And then 14% of our sample were engaged in creative-focused activities. So that included quite a variety, and that included crafting, woodwork, creative writing, and mindful photography as examples of different types of GSP activities. In terms of duration of activities, 37% of the sample were engaged in GSP activities that lasted between 1 to 4 weeks. And of those, that included participants who took part in single-day workshops, participants who took part in taster sessions, or who initially engaged with one session of GSP but did not pursue the full course of the GSP activity. Under 1/3 of our sample then also took part in GSP activities that were 5 to 8 weeks duration, and also activities that were 9 to 12 weeks in duration. And the majority of our participants, 80%, then engaged with a GSP activity on a weekly basis. Next slide, please, Anthony. So looking at our outcomes then, so starting first of all on well-being, and this is the ONS4, and looking at the first 3 subscales for well-being here, so life satisfaction, feelings of worthwhile, and feelings of happiness. So I've circled here in green the mean or the average before score for participants before they took part in GSP, and also the mean or average after score for when they took part in GSP. And while, just for ease and simplicity of the presentation, I've just highlighted this for the first subscale, it's relevant and applicable to all the subscales on the ONS4. So what we clearly see here for satisfaction, worthwhile, and happiness is an increase in that mean or average score from before engagement with GSP to after engagement with GSP. And when we look at the far 2 right columns in terms of the statistical significance, we see this is statistically significant. In other words, that GSP has had an effect in increasing or improving well-being for satisfaction, worthwhile, and happiness. When we look at the effect size, what we're interested here is in determining how meaningful are the size of the effect of the intervention. And we can see here that in terms of the statistical equivalence of this translates into a medium effect size for satisfaction, worthwhile, and happiness. And then finally, for the anxiety subscale on well-being, again, we see a decrease in that mean or average score for participants from before to after engagement with GSP. Again, that is statistically significant. So GSP has been effective in reducing anxiety from before engagement. And in this instance, the effect size is small. Next slide, please, Anthony. So looking at anxiety and depression, then on the HATS measure. So looking firstly at anxiety, we see a decrease from the average score for participants from before to after engagement with GSP. That is statistically significant. So GSP has been effective in decreasing that anxiety score, and that's from a moderate to mild threshold in this instance. Again, the effect size translates or equates to a medium effect size for GSP. And for depression, we also see a decrease in that score from before to after engagement with GSP. And that translates to a mild depression score before GSP engagement to within normal threshold ranges from after GSP engagement. Again, GSP has been significant in bringing about that decrease in depression score, and the effect size translates to a medium effect size. Next slide, please, Anthony. So while the last 2 slides showed that GSP was effective in terms of improving mental health and wellbeing outcomes, we're also interested in determining if the duration of the GSP intervention helped to explain or was associated with those benefits to mental health and wellbeing. So we explored this statistically while controlling for deprivation, so I refer to the IMD deciles and demographics, and also health status of the activities of daily living. And we wanted to isolate the impacts of these 2 particular variables because we know that these 2 variables are often associated with mental health and well-being in terms of impacting an impact on mental health and well-being. So we looked at duration of GSP categorized as 1 to 4 weeks, 5 to 8 weeks, and 9 to 12 weeks, and we compared those across the 3 subscales on the ONS4. So life satisfaction, worthwhile and happiness here in purple, and also on the anxiety and depression subscale here in green on the HADS measure. And what we found that interventions, GSP interventions that were 9 to 12 weeks in duration compared to those that were within 1 to 4 weeks in duration had a greater benefit for life satisfaction, worthwhile and happiness. And in addition to on the happiness subscale, we also found that GSP interventions that were in duration of 5 to 8 weeks compared to 1 to 4 weeks also greater benefit for the happiness subscale. Then in relation to anxiety and depression, we found that GSP activities that were duration of 5 to 8 weeks compared to 1 to 4 weeks showed a decrease in anxiety scores. And for depression, similarly for 5 to 8 weeks compared to 4 weeks, we also saw that decrease in depression score. So equating to a 2.32 difference for anxiety and a 2.47 point difference for depression. So overall, from this cohort evaluation, what we found that GSP interventions that were a duration of between 5 to 12 weeks were associated with the greatest benefits for both well-being and mental health. And I'm just going to hand over now to my colleague, Dr. Peter Coventry, who's going to talk about the findings in a little bit more detail and also some of the challenges around the cohort evaluation and areas for future research for GSP.
Thanks, Trish. Anthony, I'll just say, because I joined as a presenter, which was not my intention, my screen is inundated with lobby requests and all the chat keeps popping up. So as I'm talking, you'll hear non-stop announcements. So I can't do anything about that.
That's okay.
So if you hear
Yeah.
the beeps, it's Teams, not me.
Yeah.
So thank you, Trish. I'm just going to spend 5 minutes just sort of putting this in context for everybody. So, you know, the takeaway message here is that contact with nature via green social prescribing can improve both well-being and improve mild to moderate anxiety and depression. And an important point here to make is that this finding is consistent with and contributes to the existing evidence base around contact with nature or nature-based interventions, which are often abbreviated to NBIs. And at York, a couple of years ago, we did a piece of work that reviewed all the experimental evidence for the health benefits of nature-based interventions. And we showed that in the studies that we looked at, over 50 studies, taking part in things like gardening, conservation, green exercise, the very things that the Humber North Yorkshire programme has offered people in this region are indeed beneficial for these kinds of mild to moderate mental health conditions. And in that review, we also showed that these benefits were sort of optimised around interventions of 8 to 12 weeks. And our cohort study has, in a sense, found and duplicated that evidence. So it's an important sort of finding to show that what we've done here in this region is consistent with and bolsters that growing evidence base around the mental health benefits of nature-based interventions. And I get asked a lot about, well, what does this mean for clinical practice or for services in the health in the NHS? And Trish mentioned a few times this notion of an effect size. So that is an effect size that's based on taking the difference between the two means. So before someone takes part in an intervention and then measuring their scores afterwards, and you subtract the two scores to get a mean difference. We can collapse that result onto a scale from 0 to 1. By taking into account the variability within the data. That's a standard deviation. And rather than using the scale scores themselves, what we can do then is compare outcomes in our study with outcomes in other studies. So those effect sizes are standardized so that what we show in our study can be compared directly to other studies. And these effect sizes, which are around 0.4, 0.5, as I say, this scale's 0 to 1. That's quite a solid medium effect size. That's showing clinically meaningful change in symptoms. And we know in primary care mental health services, research shows that things like CBT and behavioural activation offer similar treatment effect sizes. So what we're showing here is that green social prescribing offers equivalent and sometimes better clinical effect than low intensity psychological therapies for depression and anxiety. So it's offering us options within the NHS system in terms of signposting and referring onward to people with mild to moderate health problems who may well not want to go through a therapeutic pathway, or maybe they've already been through that and it's not appealed to them. And so this is a means to combat their unmet health need. Next slide, Anthony, and just go through the animations. We'll just get everything on this slide. So, the cohort study offers a real insight into the mental health and wellbeing benefits of nature-based social prescribing. It would be remiss of me as a scientist not to flag up a few caveats and limitations to this research, which points us in the future directions about, well, what might this research help us do next? What's the next challenge in terms of demonstrating the health benefits of GSP? So GSP is a complex intervention. It's made up of lots of different components. It's not just the end of the pipeline, which is the activity. We've talked a lot about the activities such as horticulture, conservation, green exercise. We know that that pipeline includes lots of processes, including contact with a link worker, maybe contact with a GP provider and other community-based providers who may have a say in onward referral to a GSP intervention. What we've done in the cohort is essentially evaluated the end of that process. So we're seeing the mental health benefits of the activity. And I know as part of the national evaluation and some of the qualitative work, that has taken a more broader view, the referral pathway and the role of the link worker. So as it stands, we're probably more likely to say that our findings relate to the impact of the activity as opposed to the impacts and quality of the contact with healthcare professionals. And I think Hannah mentioned in her introduction that there's been a few challenges around referral pathways. Some have been well established for some years, some are new. Self-referral was the most common entry point for GSP in this study. And so in future, there's obviously a piece of work there to make those pathways more robust, more consistent, and also meeting the needs of people who may not have access to GSP. And related to the complexity issue is, as you saw with Trish's slides and the screen grabs from Anthony's maps, there's been many providers who offer very many different types of activities. And so there's lots of heterogeneity, from gardening to mindful photography to nature walks to green exercise. And our evaluation had to collapse a lot of this variety into quite broad categories to allow us to do our work. So we used the categories from the Nature on Prescription handbook. But of course, by doing that, you perhaps do lose some of the individual and specific features of different types of activities that might well be important. So that's something to bear in mind. And that relates to us perhaps yet still not quite understanding what the actual mechanism of action is here. What is the active ingredient in GSP? Is it the activity? Is it both activity and link worker? Is it the greenness of the space? One thing that we didn't look at was the nature of the habitat, and some activities were in more greener areas than others. Was it the group focus, or was it the social contact? So all these things weren't in our evaluation and are things for us to think about in the future. I'm getting an awful lot of feedback. I can barely hear myself think.
Yeah, can everyone make sure that they've muted their microphone?
I'll plough on. Two final points, just in the interest of time and giving others to talk and ask questions later. This was an evaluation of short-term benefits. So we're looking at evaluations that typically activities that were offered between 9 and 12 weeks or less. And of course, in terms of thinking about how sustainable this is, we're quite keen to understand whether the skills that people learn as part of GSP are transferable, and they can take those skills onwards to other settings and other contexts and use them for their lifelong learning. And so a longer and more sort of sustainable piece of work would be of interest. And although a lot of the people who came through this study had mental health problems, some had levels of disability, so we're indicating that they had physical health problems, we still have less evidence about how beneficial GSP is for those who might have long-term health problems, multimorbidities, and more severe forms of mental illness, which might mean that the providers have to offer more bespoke and tailored offers compared to what we evaluated in the cohort study. But those are things to think about in the future. And just to sort of reiterate that, you know, we've had the opportunity to work with Antti and Hannah on this, and I think we've produced a really valuable piece of work that showcases the clinical benefit of contact with nature. And I think, Anthony, the links and the report are going to be available to the webinar guests. So there you go. That's the one I'm just referring to. So we've got the report that you can link to the university web pages, which includes much more detail of our findings and the statistical sort of methods that we use, if that's of interest to you, and discusses the clinical significance of our findings.
Brilliant, thank you, Pete. Yeah, I'm just going to quickly try something with the settings, and then we're going to pass over to Heidi Moon from York CVS.
Anthony, hi everyone. Can everyone hear me?
Yeah.
Good.
Yeah.
Yeah, so hi, I'm Heidi. I'm a social prescriber in York. I've been involved in the Green Social Prescribing programme, and I'm just going to talk about a bit of the work I've been doing to look at ways to embed nature-based activities into the primary healthcare system. So next slide, please. So just to give you a bit of context, I'm a primary care link worker. Seems to be recycling collection day here, just to add to the fun. So I'm not sure if you can hear that. So yeah, I work across 2 surgeries, and I work with a team of 3 others really closely across our PCN. In York, also based at CVS, we have a team of social prescribers who work in secondary healthcare as well. So altogether, there's just over 20 social prescribers across the 2 teams. As a primary care link worker, I take referrals from the surgery staff, but patients can also self-refer. And the referrals that I get will usually state what sort of things the referrer wants to address or highlight, and perhaps what issues the patient's got. And then I'd have an initial appointment with the patient and discuss what's important to them, what they'd like to address through working with a social prescriber, and we'll create an action plan together. Although we advise around all sorts of needs, issues and interests, I often find that I'll be recommending some kind of nature-based activity to patients because of the huge range of benefits that participating can have on their physical and mental health, as we've seen here today. And in the research, the benefits are numerous, and really the outcomes can only be positive for a patient, regardless of what their needs and issues might be. Next slide, please. So what I've kind of found in my time social prescribing is that some of the wonderful things about nature-based activities is that it doesn't necessarily need to be based on a person's condition or what they can't do, which is quite refreshing. We can speak to a person about what they can do, and we can build on that. We're really fortunate in York. We've got a wealth of small green spaces managed by voluntary groups and a river running right through the city. So generally we can find something for a patient to participate in within walking distance or a short cycle or bus ride. We even have some activities that will come to a patient's home. A lot of the activities patients can access can be quite flexible in how people work, when they work. It means a patient doesn't necessarily have to make a time commitment, and they can have flexibility in how closely they work with others. It's really helpful for those who might be anxious about working in a group. It would mean they could possibly have the option to sort of work on the peripherals of that group to begin with and slowly socialise more. And a lot of the activities are free, which is, you know, a massive benefit and breaks down a massive barrier straight off. Next slide, please. So talking about the work I've been looking at around embedding green social prescribing, a key part of it, of being part of the Test and Learn programme, was to look at this. There are some really good examples of this already in various places across the country, and I think it's really important that we look at these, how we can build upon, replicate and use these examples to ensure that it becomes commonplace that patients are offered opportunities through the healthcare system that can potentially benefit their health, help the environment and save the NHS money. It's just a bit of a win-win, really. So yeah, I'm just going to have a quick look at some of those bits. So if we can go to the next slide. So yeah, I started by sort of looking to build relationships, speaking to the organisations that can offer these opportunities across the city, to give me a thorough understanding of what they could offer and who they could accommodate. So then I could sort of also speak to them about how social prescribing works. I could offer them support from York CVS. You know, we've got people that can help with funding, training staff and volunteers, volunteer recruitment and networking. So it's sort of a really nice two-way street, having those kind of conversations. And then once I've kind of got a really good knowledge, I've been able to share that with my team. So just to kind of make sure that we're all really up to date on what's going on. Ongoing conversations with patients and colleagues about what people want, what interests people have, and also what barriers and issues might make in participating in the green activities a challenge. I've then used this knowledge to look at gaps, consider which patients we might struggle to place, and think about whether this might be able to be solved by nature-based activities. Next slide, please. So yeah, in terms of sort of raising the profile of green social prescribing, sharing information, this is kind of been a key part. So obviously, like I spoke about, growing my information of what's available locally, considering options for communicating and showcasing these local assets. So some ideas have been putting literature out in surgeries and on the TVs in the waiting rooms, sharing information in surgery newsletters, presence at different various drop-in sessions and patient participation groups. I've created a map of York's green spaces, so anywhere where people can access the nature-based activities and opportunities, and then info on there about what the volunteering groups sort of involve. So I've been able to share that with my fellow social prescribers, but also the health professionals, just to sort of, again, sort of showcase what's out there. We have the wonderful Health Watch, mental health and wellbeing and dementia guides, which is publications that we give out all the time, and these organisations are in there as well with a bit of information, so that's a really good way. I've been in to speak to different surgery staff groups and also a few groups of student doctors, so first year students, about both social prescribing in general, but also the green social prescribing, some of the research, showing the benefits, and also sharing that kind of information with them about what opportunities are available. And I'm going to be holding a webinar in a couple of weeks' time to showcase the findings that we're looking at here today, and some other sort of related research, but also share that information of what we've got available locally and how patients can access these opportunities. and then sort of looking to, you know, gather some more ideas about this embedding. I'm going to open this to anyone who's interested, but we're really going to target the healthcare professionals and colleagues in local organisations to facilitate networking and idea sharing. So yeah, hopefully a lot of the healthcare staff will come along to that. Next slide, please. So I've also supported 2 projects looking at transforming green spaces which are attached to surgeries into community gardens. So here I've been able to support the community groups that are managing those to access some of that support from CVS. Linking them up with other organisations I know about. So for example, one of the groups I've put in contact with our local recycle project, and they'll be helping them to make some raised beds. Liaising between the community group and the practice managers and staff within the surgeries. I've been working with these organisations to consider what the volunteer support might look like through my knowledge of sort of what people want volunteering to look like, and what's going to be kind of most benefit to those groups. Obviously we'll be linking those patients into those projects, so we'll be able to sort of provide hopefully some volunteers to that. But also because those green spaces are literally attached to the surgeries, it means that, you know, when sat in an appointment with someone, if we're in those surgeries, we can literally take them out and look at those gardens and point out, you know, what sort of things the groups are doing. So, you know, it's brilliant, it's right there. So that's been a really nice kind of project. Next slide, please. So yeah, what's next for this work? Obviously, you know, I've got a few more hours on the Green Social Prescribing project, so I'm going to continue with some of these bits. As I said, host a webinar to at least kind of get the word out there, continue work around identifying the health inequalities and look at how green opportunities might be able to tackle some of these issues. I'm always trying to raise the profile of both social prescribing and the health benefits of spending time in nature, so that, you know, that'll always be part of my work. Collaborate with colleagues and organisations to grow their offerings, particularly where we as social prescribers have identified gaps in the city and provision. Keep talking to healthcare colleagues and professionals. And that hopefully, you know, in some cases that's going to be as simple as just tweaking an offering to remove a barrier. And just some thoughts around any groups who could potentially be targeted to support either implementing or growing projects. A group that I often come across is the sort of newly retired or people that have, you know, been retired for a little while. So look at how could these groups be reached? What sort of opportunities might they be really well matched with? And that sort of matching up of kind of information. So that's just a few of my thoughts. So yeah, thank you very much. And
Excellent.
I hope at least somebody heard that.
Yeah, brilliant. Cheers, Heidi. So we're going to move on now to hear from 2 of our funded projects. So first, I'd like to welcome Rob and Claire from Raincliffe Wood Community Enterprise in North Yorkshire.
The mic's on now. Can you hear me, Anthony? Is that okay? Right. Claire has been having technical problems, like many have been reported, so she may not be able to contribute. Just a little bit about who we are as an organisation. We're not for profit and we're established in 2013, and 2 main purposes. And next. We're looking after a huge woodland complex, 222 hectares. And it's an ancient woodland, and it includes a national nature reserve, so that's demanding in itself. And the second one is that we're set up to maximise the health and well-being benefits from the woodland, and it's just 1 mile from some of the communities in Scarborough with some of the worst health outcomes. So there's a market there, but it's reaching out. Next. And what our experience, it's easier to deal with the members of the public who bitterly oppose felling trees, and there are plenty of councils in the country that have experienced that. That's the easy bit. The difficulty for us is engaging people in the community and members of the public. That's the hard bit for us, and that's because the motivated and active they're already in the woodland. It's the people who are not motivated and active that we're trying to reach out to. Next. And our journey has been 2015. We actually took on the woodland, and our target group then were school children, the excluded, where a lot of children in Scarborough who have a poor educational attainment. But it was too expensive and too demanding for us to start from scratch, and we abandoned that approach. And I'm really sad that we did, because when we have had school children out, within an hour or 2 hours, the improvement in their nature and well-being has been profound. It's observable and measurable, and I think that the CAMS service could look at delivering green social prescribing for some of their patients. 2018, we became aware of the social prescribing, and we felt we had something to offer, but it was engaging with social prescribers was our difficulty. Next. And we couldn't see how, as with the children, without some funding, we couldn't see how we were going to be able to grow and deliver some sort of service around the woodland and green environment. And then we were fortunate, we didn't have any staff, and so when COVID struck, it actually changed things for us, because the woodland and well-being became a talking point, and things had swung towards us as an organisation. And then 2020 was a big year for us, because that was the first time we took on a paid employee, a community woodland manager, and we were fortunate that he had both forestry and community engagement experience, and that was a really excellent start for us on this journey. Next. And during 2021, we actually arranged a meeting with a social prescriber in the woodlands, and they could see the benefit and could see what it was we were trying to offer. Next. In May, we started delivering wellbeing walks in the woodland, but throughout the rest of the year, we didn't get any referrals from the social prescriber. We were fortunate in 2021 to get some funding from the North York Moors National Park, a scheme called Farming in Protected Landscapes, and that enabled us to employ a person with heritage crafting skills, which extended our offer beyond just woodland walks. And then shortly after that, we became aware of the A Smile and the Green Social Prescribing Programme, which blended very well with what we were going to offer. Next. And in May 2022, our Woodland Heritage Officer started delivering the crafting events, but at that stage we hadn't got any GSB referrals. And then in September 2022, we met up with Scarborough Age UK and the social prescribing team, and that really has built a much stronger relationship, and we've got an ongoing pattern of referrals and events being developed all the time. Next. And throughout 2023, we are delivering an extensive programme of events and walks with seasonal themes, and we're also arranging specific programmes for the Age UK team, where they've got people with specific needs, and we can match an event or walk for their particular needs. Next. And our experience, well, the referral pathway to be better understood from primary care, especially from our perspective of trying to deliver the opportunities, it's not clear, but I think that's come through in some of the previous speakers, and understanding the barriers that the clients face and ways in which those barriers can be overcome, and clothing, transport are ones that spring to mind. Next. And the point about paperwork, I certainly don't like the idea of finishing a walk I've been out on and then having to fill in paperwork. It's counterproductive to what we're trying to achieve. And we're not seeing many from the communities that are in greatest need in Scarborough, and I think that's from my perspective, a disappointment. And this is what we offer, and Claire, don't think she's able to connect. Claire is our Woodland Wellbeing Officer, and she's extending the programme of work way beyond just the wellbeing, forest bathing and other mindfulness activities in the woodland. And the feedback all the time is so positive from everyone who attends, and we get repeat attenders, and it's also helping to build our volunteer groups as well, which is an ongoing programme of work that I think benefits people who've initially been referred through the Green Social Prescribing. So I'll finish there.
Excellent, thanks, Rob. If you can just go on mute. Brilliant. Yeah, and apologies, Claire. Claire was with us to begin with, but we seem to have lost Claire. So I'm going to pass over to Emma Bateman now, who's a freelance artist who has been delivering activities at one of our funded projects at Myersbeck Plant Nursery in East Yorkshire, to talk about what they've been delivering.
Hi everybody. Yeah, my name's Emma and I'm a full-time artist. I'm the owner of Emma Bateman Art. I was also one of 2 teachers who delivered the Art in Nature Green Social Prescribing project for Myersbeck. I hadn't actually heard of Myersbeck before I came across the advert, so I just wanted to tell you a little bit about why I actually wanted to get involved and become one of the teachers. So basically, art for me has been something that's kind of got me through difficult times in my life, so I'm kind of very much aware firsthand of some of the therapeutic benefits, and obviously I wanted to be able to pass this on to other people. When I actually visited Myersbeck as a place in itself, it's quite an incredible place what they do. They've got 15 acres of conservation woodland. People with learning disabilities come here via the council and they do horticulture. They kind of clear pathways in the woodland. There's a really amazing feel here and it's got a fantastic community spirit. And I just thought straight away it was something that I wanted to get involved with. So can I go on to the next slide, please? Thank you. So basically, my approach to the project was quite instinctive because I just basically used the techniques that I've been using myself. So we started off by doing a lot of kind of work around colour and mood. We went for a walk in the woodland. We kind of observed different colours in nature and how they work together. And then we created our own colour wheel. And then we did some kind of art installations in the forest as well. So as well as painting, we kind of foraged for different materials. We made mandalas around trees, and then we kind of observed how those patterns kind of decayed over time with the different weather conditions. Yeah, and we did a little video series about that as well. We also took lots of flowers in the woodland. Sorry, not flowers. We took lots of photos in the woodland of the different flowers and trees, and then we painted our own versions as well. And it was just really interesting to see how everybody kind of, all the social interaction as well, and how people kind of form different friendships within the group. And also it was about kind of learning new skills for them as well as relaxing. Next slide, please. So this is just a few examples of some of the work that we did. So you can see here, there's somebody sketching a poppy seed head, and these are some of the forage materials that we gathered from the woodland, and everybody kind of took on a different role. Some people collected and gathered, then other people kind of raked an area around a tree, and then we laid it all out and we kind of designed it first. Yeah, so that's just, like I said, a snapshot of some of the work that we did. Yeah, and I've just got a couple of case studies here. So we had a really kind of wide range of different people with different kind of needs. So Helen was a lady who she had quite a high-flying career, and she became really burnt out. Specifically, she said actually during COVID, because she was confined to a house, and it was all kind of calls, online video calls, Teams meetings, and she wasn't getting any social interaction because she's single, and her children have left home. So that was really affecting her mental health. And after COVID, she ended up leaving a job because she felt she wasn't able to do it anymore. She wanted to join the art therapy class as a way for her to kind of relax and restore her energy levels. You could tell when she first started how anxious she was actually. And she changed during the course of the programme. She became a lot calmer. I think she was very nervous to start with and anxious at the beginning. By the end of the class, she'd talked to us all about embarking on a new role, and she went back to work. And yeah, so it kind of served a purpose for Helen, and she enjoyed it, and she's gone back to the old Helen. It's been very different for everybody though. So if we can just go on to the second slide, sorry, the last slide. So another lady who came to the class, Millie, she was around 80, retired, but with a number of chronic pain conditions, which also were affecting her mental health quite badly. So Millie actually attended with her husband, who used to drive her here, and she loves art, she loves gardening, and basically it became a bit of a lifeline for Millie. Every week she would look forward to coming to Myers Beck, being out in the woodland, meeting new friends, and doing art with encouragement as well. She needed a lot of kind of encouragement with her art. You know, she very rarely missed a class, and she got really upset if she couldn't attend for whatever reason. When the programme ended, it was quite difficult for Millie, and it was a bit of a concern, I think, for Karen and myself, because she'd become quite reliant on it. But what we've done is we've kind of encouraged her to be a supporter of the charity. She comes to all of our events that we hold, and she does artwork at home now, and she's joined a few other groups. And she recently donated some vases that she painted, and somebody bought them all and commissioned her. So that was a huge confidence boost to her. But I know she does still miss the group. So that's something I think that's maybe not been factored in, that what kind of happens at the end of some of these projects to the people that have been on them. But that's just a snapshot of 2 case studies. Thank you.
Brilliant. Thank you so much, Emma. So yeah, please do put your contact details in the chat as well. And I've shared Fiona, who's the other art teacher. I've shared her details as well. Excellent. So firstly, apologies for the technical issues. I really have tried in the background to sort of sort some of these out, but haven't been able to do so. And thank you for all the speakers that have joined us today. Just wanted to sort of summarize, you know, key lessons. The work that we've done, the partners that we worked with have really shown, you know, how beneficial outdoors and in nature activities are for mental health and well-being, but we do need further investment. We need to maintain this momentum through things like bringing green social prescribing as business as usual through various different pathways, and building it into protocols and processes and continued professional development and things like that. And yeah, that sustainable investment into the community sector, and we can be inventive in how we do that through ways such as shared investment approaches to give the voluntary sector that stability and confidence to invest in their workforce. Continue building the capacity of providers of outdoor and in nature activity. Increase the evidence base, as Pete and Trish have talked about, you know, getting more information, and that continued connection and networking. So it doesn't end there with the end of the Test and Learn programme. We're fully committed to green social prescribing and pushing things forward. So Hey Smile Foundation have secured just under £250,000 from the Community Fund to support growing green and blue health, and we'll be working with the Humber and North Yorkshire Voluntary Community and Social Enterprise Collaborative leads to deliver that. Hannah, do you quickly want to say something about the work with York St John's?
Yeah, thank you, Anthony. So we've got some funding to work with a number of ethnically diverse communities in Hull. So some really great organisations like Hacker, Solidarity, and we're looking at developing a participatory methods study, which is looking at helping them to evaluate their green activities. So that's ongoing and is coming along really well.
Brilliant. Yeah, and through fundings from Natural England, we've got some money to do inspiring diverse nature activities. So again, working with minority ethnic communities and facilitating access to nature and the outdoors within Humber and North Yorkshire. Connectivity and networking continues. As I say, we're still linked to the VCSE Collaborative, and our steering group has committed to continue meeting throughout 2023 to look at opportunities for green social prescribing across the region. And our national team is still there in the background doing work around strategy, governance. They're producing a green social prescribing toolkit and also doing further work to evidence green social prescribing. So I'm going to hand over to Gary now just for a few final words.
Thanks, Anthony. So yeah, I'm Gary Sainty. I'm head of VCSE for Humber and North Yorkshire Health and Care Partnership and the vice chair for the Green Social Prescribing programme. And my role in a nutshell is connecting the voluntary sector up to health and care. And I think what we've heard today and what I've seen over the last 2 years of working with the Green Social Prescribing programme, it shows that really good mix of voluntary and community sector organisations working with statutory partners, having those partnerships in place to deliver something for our people and our communities that are after that support. So I think it's been a really good mix, and I can see that coming through a lot in everything that's been done. I think today's event's been really useful, and thank you to everyone that's participated and battled through the technical issues that are clearly going on. I think it was great to see the statistics and the research and the bits and pieces that evidence the value of green social prescribing, but even more so as we've moved into the case studies towards the end, and that real connectedness to people on the ground and the impact that it's having on people's life. I think it's really valuable, and it's great to see that coming through. Social prescribing is something that I've been involved in for a little while, and Brent mentioned at the outset in terms of the social prescribing review that we've been doing. And from a health and care system perspective, we're really keen to make sure that social prescribing is maximised and we make sure that we make as many connections as possible. It's a really valuable tool to support the health and care of our population. So in the background, we are working on how do we do that? How do we maximise social prescribing? How do we put more investment into social prescribing? How do we connect things like green social prescribing so that it's actually part of the mainstream social prescribing offer that we've got? So there is a whole heap of work taking place in the background. And as Anthony mentioned, this isn't the end of the green social prescribing just because the test and learn site has come to an end. Actually, we've got commitment from a whole range of partners, many of which was put on those first few slides, that are committed to keeping this going and working through it. So that's all I kind of wanted to say. This bit's going to be interesting. We've got literally 5 minutes left, and this was a chance for anybody on the call that can either raise their hands, turn the mic on, raise a question for either Anthony or any of the other speakers. I'll have a slight pause and just see if anybody wants to fill that space. Is there any questions from anybody? Going to go to the chat. If it's a technical question, I'm not going to raise it. I'm not going to ask it. I can't see any hands from anyone or any questions in the chat.
John's got his hands up. John Tucker, do you want to come in, John?
Yes. I'm part of Navigo, the mental health provider for North East Lincolnshire, and we're working with GPs, and we've got a garden centre, so we're using that as well, and an allotment for early intervention psychosis. But one of the things I wanted to mention was that it's getting linked with community groups that are already existing so that we can use those to continue the work we do. So they've got a link to their actual local community. So if they've worked with us, they're then able to access the local community that they live in to increase and support their own mental health.
Yeah, absolutely, John. I agree with that, and that's part of the work that we've been doing to sort of help connect groups. But I can actually see Jeanette on my screen from the occupational therapy team at Humber Teaching NHS Foundation Trust, and they've done some great work sort of to refer and signpost people through occupational therapy into community-based activity. So yeah, me and Hannah are in a kind of good position that we get to speak to a lot of people across the whole of Humber and North Yorkshire. So I'm sure there's connections that we can make and sort of knowledge that we can share to share that learning.
It helps us not to reinvent the wheel.
Yeah, yeah.
Can I just come in on that as well? Sorry, Hannah, I'll come back to you in a second. Just on that as well, we do have VCSE community assemblies in all 6 places. So either through the VCSE collaborative, through Hannah and Anthony, we can connect you into that, so that actually we've got people that are aware of those wider community groups that actually we can facilitate conversations through. Sorry, Hannah, did you want to come in?
Yeah, I was just going to say to John that yeah, thanks. We did share some of your great work that you're doing in Navigo at the allotments with our early intervention service in Humber. So we're definitely sharing the lessons and the kind of learning.
Brilliant, Jeanette. I can see you got your hand up.
Thank you.
Yeah, I was just going to say that the way we did that was, I mean, we were lucky that on the allotment site that we've got, there's the community project Down to Earth. So we were able to take our client group, we'd visit the site several times, go down there, introduce people so that they were familiar with that site as the next place that they'd be moving on to. So yeah, supporting them to go to other community projects, actually going with them. But we did that took like several visits. But it does seem to work if you can find somebody that you can actually link into. For us, it works really well because it's actually on the same day that we run as well. But there was negotiations with Down to Earth as well before they actually set up, like the best way to do it, the best way that it would work. So yeah, I think it can work. Just talking to partners.
Brilliant, excellent. Thanks, Jeanette.
I can't see any other hands up, and given we're nearly at 1 o'clock, I suggest we try not push technology too far and probably finish it there. I think it's not a question, but in the chat I see, and thank you, Emma, for putting that comment in. I think that brings it back to everybody in terms of why we're doing what we're doing and what Green Social Prescribing can do. So thank you for sharing that. I'm just going to reiterate the thank yous that have already been said from Brent and everybody else in terms of the great work that Anthony, Hannah and the team have done. The steering group that have led the programme from over the last 2 years, and obviously all of your organisations for delivering the great services. So thank you very much for that. I'll just hand over to Anthony for any final words, but again, thank you.
Yeah, again, yeah, just thank you, everyone. It's been an absolute privilege working across Humber and North Yorkshire with all the different groups. And yeah, just apologies for those that had technical difficulties. So we will share the reports, we will share a recording, and also give people an opportunity to ask questions kind of via email, and we can compile those. So thank you very much for coming along today, and we look forward to continuing this work across Humber and North Yorkshire. So yeah, thank you very much, everyone.